Welcome. The Minnesota North Dakota chapter of the Alzheimer's Association would like to offer some tips and resources for dementia care for those who are testing for COVID-19 in a variety of settings that you may be working with people with dementia. My name is Kendra Binger, and I'm a program manager with the Alzheimer's Association serving Western Minnesota.
And my name is Jenna Fink, and I'm the Senior Community Services Manager with the Alzheimer's Association, working out of our Minneapolis office.
So today we're going to provide a brief overview of what's dementia, a little bit more information on Alzheimer's disease, some common behavior and communication challenges with those living with dementia, and then some site-specific resources that might be helpful if you are testing for COVID-19 in individuals living with dementia. So to begin, we know that dementia is not necessarily a single disease, but it's rather a group of symptoms. So if we think about dementia as an umbrella term, we know that it's not just one diagnosis, but different symptoms that may include changes in memory, language, the ability to pay attention and to focus. But we know that dementia is definitely progressive and it's damage to the brain cells. So we know that dementia is an umbrella term. An Alzheimer's disease is simply a type of dementia. There's multiple different types of dementia, all starting in different parts of the brain, and may exhibit different symptoms initially. But as any dementia progresses, we know that different functions of the brain will be affected. Memory, logical thinking, behavior regulation, mood, all of those different functions may be affected as that dementia progresses. So we know that not all dementias may affect an individual the same, but we know that all of these different basic tenets of thought or cognition will be affected eventually. So things like memory. Typically those living with Alzheimer's disease may experience changes with short-term memory first, but long-term memory will still be pretty good. That person might experience changing in their ability to understand abstract thought. So things that are not tangible, that they can't touch, see, or hear, may not resonate with that individual. They may also struggle to understand reasoning. They may not understand the reason why you're coming to test because they may not remember that there's a pandemic. They may not remember why we need to be washing our hands or practicing social distancing. Also, people may revert to a native language. So they may not understand what you're saying because they've lost that ability to truly recognize and understand what you're verbally trying to tell them. So we know that there's a lot of changes happening with any dementia that may affect that person's ability to navigate their environment. We know that Alzheimer's disease is the most common type of dementia. We know that it is progressive. We know that it's a fatal diagnosis, and there's no way to stop, prevent, or cure the disease at this point. But we do know that there's treatments to manage the symptoms of Alzheimer's to help that individual maintain independence a little bit longer. And we know that Alzheimer's disease is not a normal part of aging. So with any type of dementia, like we've talked about, we know that there's changes with the person's ability to not only understand verbal communication, but their ability to communicate with others around them verbally. And especially when we think about now that staff or people in their environment may be using PPE or look different than they maybe have recognized them in the past. So we know that as any dementia progresses, that individual is starting to rely more on body language. And if PPE, if that person is wearing a mask or a face shield, they may not be able to see that person's face, and they may misinterpret signals because they can't see that person. So we know that that might be a challenge to somebody living with dementia and to those who are trying to test for COVID-19. And they may struggle with the ability to get the right word out or say what I want to say, and it may come out in a very different way, different words, and that may cause a lot of frustration for that person. They may repeat themselves over and over. They may not have the ability to read. If you're trying to communicate with them with a pamphlet or this is what we're doing on a handout, they may not have that ability anymore to understand the written word. So that may not be an effective way to communicate with that person. Like I had mentioned before, if that individual did not spend the first few years or decades of their life speaking the language that they did as an adult, as that person's time traveling back in time, they may revert to only speaking that native language, which can be tricky if nobody around them speaks that language. They may also have some struggles with speaking in clear sentences. Again, kind of a word soup phenomenon, or they're not able to understand what you're telling them, especially maybe directions. You want them to do something, come here, we're going to do this, or I need you to do this. They may not be able to put all of that together and then execute that plan. Also, the ability to use those right words. And things may come out in more of a word soup, and it may be up to you to kind of pick that apart to figure out what they may be trying to tell you. So when you are in a situation where you may be testing for COVID-19, and you know that you're working with somebody living with any type of dementia, whether it be Alzheimer's disease or a different type, these are some common things that may help make your interaction a little more successful. They may seem pretty basic. They really do make a big difference in working with individuals experiencing dementia. So first off, we know we want to approach that person from the front. Don't come from the side or the back. They may not be able to understand or have good perception of what's happening outside of what's going on directly in front of them. We want to make sure that we're joining them also at their level. If they're sitting, we need to sit and gain eye contact, eye to eye. If they're standing, we also need to be standing. Always introduce yourself. They may not remember, or you may have to introduce yourself multiple times. Tell them who you are to build rapport. We're going to speak clearly and we're going to speak slowly. We're going to be mindful about long explanations. We want to keep things short and to the point. And we want to be very mindful of body language. Again, we want to be sitting if they're sitting, standing if they're standing, and just be mindful about what my body language may be saying to that person. Especially in a testing situation, it would be very helpful to minimize and think about distractions in their environment. Is it really busy? Are there a lot of things happening? They may be pulled, their attention might be pulled in all those different directions. So they may not have the ability to focus on you or what the task is. So we want to make sure we're minimizing distractions and always avoiding arguing or correcting. If you're struggling to communicate to them why we need to do this testing, we need to take a break, back off, find somebody else to help us, because we're not going to win that argument and we're going to push that person into a very agitated state. So we just need to stop, back off, try again later. Also think about when we're using PPE and we're not able to maybe see the entire face, pinning a picture of yourself to your shirt or some way to let that person know this is the person behind the mask. And always remember to smile. You can still see a smile in your eyes, and that's the easiest way to communicate with anyone. So thinking about dementia-related behaviors, most important thing to think about and keep in mind is that behavior is a form of nonverbal communication. That person living with dementia may not be able to tell you, I'm hot, I'm confused, I don't understand, I'm frustrated, so they're going to show you. They may show you in a way that says, I'm going to get up and leave the room, or I'm going to yell, or I'm going to push somebody away. I'm telling you I need something, but I don't know what that is. It's an unmet need. We know these triggers or these behaviors might be triggered by interactions in that person's environment. It may be the person in fatigues coming to provide that testing. Maybe that person was in the service, or they had a traumatic event in the past, and that Just the clothing alone might be that trigger. Or it may be too loud or too bright. We always need to be assessing what in the environment might be causing this person to act the way that they're acting. So they may become agitated. They may be really frustrated. So if you're able to work with staff in the testing process, that would be a good time to take staff who know that person well to help understand, why is this person acting that way? What can we do differently to help that person feel more comfortable with the testing process? So some common causes of dementia-related behaviors, again, especially in this time when all of a sudden everybody is wearing PPE, they may not understand daily. Why are you wearing that? What's happening? It may be a trigger for a past trauma. Other dementia-related causes for those behaviors may be, I'm hungry, I don't understand, I'm fearful, I don't know what's happening. They are not able to express those feelings or thoughts anymore verbally, so it may be very frustrating to them. They may also experience hallucinations. Overstimulation, again, if the environment is chaotic or it's too light, there's too much sunshine or it's too dark, that can cause that person to really feel uncomfortable. Changes in routine. What you're doing coming into test may be changing that day-to-day structure and the routine. And that can be really difficult for that person living with dementia. So we want to always be mindful about these things that are changing, how they're interpreting the environment, and what may be causing that dementia-related behavior in order to make that person feel more comfortable and to provide good and accurate testing. So some other tips for you to respond to dementia-related behaviors, again, and this may be more of the part of asking staff to help. If you're only there to provide that testing, we want to rule out things like pain, thirst, or hunger, or I need to use the bathroom. Maybe once those basic needs are met, they will be willing to be tested and it won't be such a fight anymore. So we need to think about, are your basic needs met? Is it the approach of the person trying to do the testing? Maybe they're unaware that they're speaking down to that person. If the individual's sitting, they're standing over them and they're talking really loudly, and that might be scaring that person. If that person is really struggling, having just a really difficult time validating that emotion. I know this is scary, I know this is tough, but we need to do this, and I'm going to be with you, and it's going to be okay. We'll be safe with me. Always acknowledging and joining that person's reality. It doesn't matter if they think that it's Christmas Day in 1973. Great. Let's talk about what we're going to have for Christmas dinner. It doesn't matter where they think they are in that time traveling process. We need to acknowledge where they're at and what they're feeling at that time. And never physically force that person to do anything. If it's just not going to happen, if that person is really fighting it and you know we're probably not going to be able to test that person today, we need to just walk away and, again, maybe try a little bit later or have somebody else try that, but never physically force that person to do something they don't want to do. So some other tips, talking to staff if available, offering a favorite food, listening to favorite music, talking about things that are important to them, putting the person before the task. If you're coming in and you're trying to just automatically start testing without building a little rapport, or at least, this is who I am, this is what I'm doing, I see you're wearing a twins hat, you must like the twins. We need to build a little rapport before we jump right into that task. So we need to put those needs first before the task. One dementia-related behavior that often happens when individuals living with dementia are stressed or they're overwhelmed or even bored, maybe wandering. And wandering is purposeful, and there's always a specific destination or a goal. And typically in the situation that you are in testing and coming into situations and kind of changing that daily routine, that individual might be trying to move away from a really stressful or a situation that doesn't make sense to them. So they may start to walk down the hallway, out the door, or away from where the testing is happening because it may feel uncomfortable to them, or they don't understand. So they want to just get away. And by getting away, they may put themselves in a situation that it may not be safe. Or they may just wander down the hall or around in that safe environment because they're not quite sure why that's happening. So I'm going to try to get away from that experience.
So as we're talking about, relating dementia-related behaviors, this understanding of dementia now to this COVID situation, which is, like Kendra said, very different, very outside of the norm and the routine for these individuals. We wanted to kind of connect it a little bit more to, you going in and doing maybe some of that testing. So to start off, kind of baseline here, with preventing illness, these things to consider. Hand washing, of course, is very important. But something to remind yourself of is that these residents may or may not have the ability to remember to hand wash or know why they're hand washing so frequently. So creating some sort of a schedule or kind of talking with staff about if that's been created for both their safety as well as yours. Covering the nose and mouth during a sneeze or cough, so using those reminders as needed to individuals with dementia, as well as refraining from touching too many things and then placing hands on the face, items in mouth, and that sort of thing. We want to encourage people to maybe stay in that particular area where there are less risks for COVID kind of cross-contamination in that, of course, and to continue taking medications appropriately. That, of course, is important as well. Oftentimes these facilities and different locations are adopting different social distancing practices, but that, of course, is important for you to consider as well and encourage or support. And then following any other procedures that would require memory or judgment support and assistance with that person. So during a crisis, how people living with dementia may respond. Kendra kind of touched on some of these points, but they really are worth repeating. So someone may have an increased sensitivity to stress, or past traumas and that. So it's really important to better understand that person and take time building that rapport. I know it takes time on the front end to do, but it really will be worth it for you and make your interaction with that person a lot easier. Someone with dementia will also have a limited ability to understand directions or explanations, depending where they are in the disease process. So it's really important to, like Kendra said, speak clearly, speak slowly. You don't necessarily need to speak any louder, but just making sure that they're understanding and really condense sentences so that we're not adding too much filler into our explanation. Individuals may also forget directions, so repeating those directions as needed and knowing that it's normal and okay and encouraged for you to tell that person 5 different times within a couple of minutes, what's going on and what's going to happen, because that will likely then reduce that anxiety or stress that they may be experiencing with knowing what's happening. People can also get easily agitated and frustrated when they're overwhelmed. Again, these are really stressful situations, really different, scenarios that are going on in residents, either, housing facilities, homes, and even, just in general out in the community. And so these things are really important to consider that people right now might be on a heightened level of that agitation or anxiety or stress. And then again, that increased risk of wandering or isolation as well. So there are various COVID-19 testing sites, and we kind of wanted to break these down for you in better understanding what those sites may be. So there could be licensed settings with consistent staffing. You can take a moment to kind of pause this video and look through this list if you want to, but in general, that's going to be places like licensed nursing facilities. So that includes memory care, as well as intermediate care facilities for individuals with developmental disabilities. Assisted living communities. Then there's going to be a different kind of tier of licensed settings with occasional staffing. So they may not have 24/7 staffing, or maybe that 24/7 support, or it might be just kind of more intermediate. And that is going to be housing with services, assisted living settings, substance abuse disorder, treatment facilities, detox facilities, withdrawal management, and that sort of setting. Then again, there's going to be this third tier of unlicensed housing or temporary housing with no staff or pretty limited staffing. And that's going to be settings like board and care homes, halfway homes, shelters and drop-in centers for those experiencing homelessness, as well as homeless outreach to unsheltered individuals. So that might be like a street team going out. So some additional tips on building rapport. You've heard both Kendra and I talk about, this, but really specifically, again, because it is so important. If staff is available, if there are those, staff or paid caregivers or caregivers in those settings, talking with them about that individual that may be living with dementia, and this is good just kind of overall, prior to testing to help provide a safe and a calm environment. Get that person who knows that individual to kind of help be their norm, of, okay, this is going to be happening, and provide that support so that when you kind of step into the situation and come in, that person might have a better understanding of what's going to happen, but also be more calm because they're with a trusted person. Additionally, visit with staff, if available, about any techniques that really seem to resonate with them. What are those things in the care plans, or how, what does that staff member know about this person that might just help with the approach? Kind of get some of that information to help build that rapport right off the bat. Introduce yourself and be conversational. Again, this is really important. Just be a person to a person. Talk like you normally would. Ask about any pictures in their room. Try to build that rapport by kind of pointing out some of those obvious things. So saying, hey, this is a great picture. Is this your family? Or if you're noticing what they're wearing, I see you're wearing a Vikings shirt. Are you a Vikings fan? Just again, building that rapport in conversation. Alternatively, I wanted to note that in kind of that third tier that I mentioned before of the settings, you may want to consider building rapport a little differently. So that was for those housing or temporary housing with no staff settings. So asking about things maybe more generally, depending on a person's living situation or, lack thereof if they are homeless. Talking about their interests, maybe rather than something that they're specifically wearing, because that may or may not have an emotional attachment, to what they what they have on. Additionally, just what kind of music do they like? Who are the important people in your life? So just kind of building that rapport in a little different way, a little more generally. And then, share information about yourself too, where it's appropriate. If you're a Vikings fan, say, hey, I'm a Vikings fan too, or maybe you're a Packer fan, and you can kind of have a little razz between the two of you to, again, build and support that rapport and that relationship that you're trying to build for that moment. Always consider your approach, like Kendra was saying, again, really important to approach in a calm manner, and explain what you're doing and re-explain as needed. So responding to the refusal of testing, very likely you're going to experience this. So some suggestions with this would be to approach at a different time of the day. If this was the first person that you were testing, wait until the end and try again. Just reapproach, re-explain what you're doing, approach in that calm manner and in a supportive and caring manner. If the site staff are available, ask for their help and support or any tips. Or if there's another guard member that might be available or another person that could test that individual, asking for their support too, because maybe that person has just a little different way of interacting with them that they like better. We're all individuals, and someone with dementia has those preferences too. So some recommendations, though, for you based from the Minnesota Department of Health. So if someone does refuse testing, like Kendra said, we do not want to, hold someone down or, do anything like that. They have the right to refuse. So this was from the Minnesota Department of Health with their point prevalence study toolkit. or I should say survey toolkit. Facilities should isolate untested roommates of COVID-19 positive residents to their current rooms and use transmission-based precautions. Other residents who have not been tested should be closely monitored for change in condition that warrants COVID-19 testing and/or isolation. Facilities should continue to engage with residents about the importance of testing, including through rounding providers if possible. Residents with unknown COVID-19 status pose a potential transmission risk to the rest of the facility. So as you're doing some of these testing and interactions with people, you may come across some individuals who are experiencing some sort of abuse or self-neglect. And whether you're a mandated reporter or not, anyone can make a report to the Minnesota Vulnerable Adult Reporting Center, and that's specifically the Minnesota Adult Reporting Center, MARC, or what it's called. And so you can make that report 24 hours a day, 7 days a week. You can either do that online, or that's something that you can phone in as well. So just some additional resources for you here. Of course, the Minnesota Department of Health has excellent resources and information. The Minnesota Senior Linkage Line is a great resource for you as well. And the Minnesota Office of Ombudsman for Long-Term Care could be a support in those long-term care settings that residents may live in. Additionally, your supervisor or, of course, the Alzheimer's Association. Just to briefly give some of this information to you, since I mentioned the Alzheimer's Association as a support, we're here all the time for this, kind of specific situation of any COVID-related questions that you have related to dementia care and support, but in general as well, in case this is affecting your personal life. And so we have various ways that you can get in contact with us. We have a 24/7 helpline that's available anytime, any day, doesn't matter when you call. We have a website that's available as well all the time, and we have many different other modalities on social media to get in contact with us and gather some more information and resources. So with that is the end of our presentation. I hope that this is helpful to you as you're going out to these various testing sites. And again, please feel free to reach out to us if you have any questions or need to talk a little bit more specifically about challenges that you're experiencing, things that keep on coming up. Our association is here for you. We want to help support you and help support those with dementia, living through this really challenging time. So thank you so much for your time, and thank you so much for all that you do.